On February 28, 2021, the Philippines' first COVID-19 vaccine delivery touched down in Metro Manila.
We welcome this day with high hopes of finally ending the COVID-19 pandemic in our country.
Since then, 43% of Filipinos have been fully vaccinated. But over 9 months since the first COVID-19 vaccine was given in the country, health officials are now asking millions of Filipinos to come back for a booster shot. So, what are boosters supposed to do? And what does this mean for the pandemic? A booster shot is an additional dose of a vaccine given to someone who has already gotten what's called a primary vaccination series. In the case of most COVID-19 vaccines, that's 2 doses, or 1 for Johnson & Johnson's. With these primary shots, our immune system is, well, primed. A response is generated to teach our bodies how to recognize and fight off a virus. During the pandemic, one main goal of vaccination is to prevent severe disease, hospitalizations, and deaths. A booster becomes necessary after the immunity and clinical protection provided by these original shots falls below levels deemed sufficient. Data had emerged that for high-risk individuals, there was a reduction in protection against those severe outcomes, which is what scientists started to notice when they looked at countries like Israel, the United Kingdom, and the United States.
In the States where, well, also in Israel, no, in the UK, where the vaccines had been given much earlier, no, they've already seen waning immunity, no, especially among the elderly.
Scientists and medical experts say boosting can help people maintain their level of immunity and protection for longer. So far, health officials have recommended people vaccinated at least 3 months ago to get boosted. The Food and Drug Administration has allowed shots made by Pfizer, Moderna, or AstraZeneca to be used as an additional dose. If it hasn't been 3 months since your second shot, don't worry. Experts say you can still be confident with your level of protection.
When we started vaccination, most of the experts thought that it will take 12 months. 12 months and then you need a booster. It has nothing to do with saying, those vaccines are efficacious in the first place. No, we're just seeing more results as the months roll by.
With more countries rolling out boosters to wider populations, what does getting an additional dose mean for the virus? And what should you expect once you get boosted?
At the population level, no, boosters will help preserve the health system. No? If you preserve the health system, no, you allow it to function, to also treat people with other diseases. At the individual level, no, people who have comorbidities, no, or immunocompromised, no, have their risk, no, reduced, no, by having boosters.
While countries have gone ahead and rolled out booster doses, there are still a number of questions scientists want to answer, like how long protection after full vaccination will last, how often we might need additional shots, and if 3 instead of 2 doses are what people will need from the get-go. Many scientists now argue that the case for boosters is becoming more urgent in light of new variants. Just recently, the World Health Organization designated Omicron as a variant of concern. It was the latest to be given this classification after the highly transmissible Delta variant ravaged the world. Scientists are still studying how transmissible the variant might be, how deadly it could be, and how it might affect the performance of our vaccines. So far, early studies have shown that Omicron affects the immunity produced by current vaccines, but that an extra shot could restore some of the protection lost. This is especially true for people like the elderly and those at highest risk for severe illness and death.
I think we can safely say now that the Omicron variant is able to evade the neutralizing antibodies from the vaccine. Not completely, but it can. So if you have fewer antibodies that can fight it, then it means more infection and not just more transmission. So madaming magiging infected sa population.
But one big question many still ask is, should countries be giving boosters to their entire populations while access to vaccines remains unequal around the world?
Let me be very clear. WHO is not against boosters. We are against inequity. Our main concern is to save lives everywhere.
Right now, the Philippine government says there will be enough doses to cover the needs of millions of unvaccinated Filipinos and millions more who will become eligible to get boosted in the coming months. Recently, more experts underscored that boosting and reaching the unvaccinated are both important efforts that shouldn't need to compete with one another.
I'm not saying do the primary series first and then delay the booster for later. No, they can be done simultaneously, but we have to make sure that we allocate the right amount of resources, no, for goals with higher priority.
Boosters will help keep up our protection against COVID-19, and eventually, experts say it could even help reduce circulation of the virus to the extent this is possible. But as the pandemic stretches, COVID-19 will continue evolving, finding ground in unvaccinated communities and giving it enough steam to keep on changing. The emergence of Omicron reminds us of something we've all heard many times during the pandemic. Nobody is safe until everybody is safe.
Omicron's very emergence is another reminder that although many of us might think we're done with COVID-19, it's not done with us.
So even in the rush to get an additional shot, it's worth remembering that vaccination works best when we achieve it together.